Do you know how to use Elaspen? Don't worry, Dr. G is here to help. Here's the Elaspen, complete with a pen cam, cartridge holder, dose window, dose selector, and injection button. Using the Elaspen, you can easily deliver anywhere from 1 to 60 units of insulin in a single administration. If your Elaspen is stored in the refrigerator, remove it 1 to 2 hours before injection to allow it to reach room temperature. Before the injection, wash your hands and ensure that you have a new needle and an alcohol swab. Take out the Elaspen. Check the label on the pen to ensure you are using the correct type of insulin, which is especially important if you administer more than one type. Verify the expiration date on the Elaspen. Do not use an expired Elaspen. To use the Elaspen, remove the pen cap. Inspect the Elaspen for any signs of damage, such as cracks or leaks. Then, observe the physical appearance of the insulin. Insulin glargine, Aspart, and Lispro should appear as clear liquid, while pre-mixed insulin, Aspart 30, Lispro 25, will appear as an off-white suspension. If pre-mixed insulin is to be injected, always mix it before injection. Roll the pen between your palms 10 times, keeping it horizontal. Then gently move the pen up and down 10 times, ensuring the glass ball moves from one end of the cartridge to the other. Check the insulin to confirm it is uniformly white and cloudy. If it is not, keep rolling and vertically moving the pen until the insulin is well mixed. Wipe the rubber seal with an alcohol swab. Remove the protective seal from a new needle. Screw the needle tight onto the cartridge holder. It is important the needle is put on straight. Please remember, always use a new needle for each injection. Do not reuse needles. Select a dose of 2 units by turning the dose selector clockwise. Remove both the outer and inner needle caps. Keep the outer needle cap for later use and discard the inner needle cap. Hold the Elaspen with the needle pointing upwards and gently tap the cartridge holder several times to make any air bubbles collect at the top. Then, press the push button until it reaches the end and 0 is displayed in the dose window. A drop of insulin should appear at the needle tip. If you do not see a drop of insulin, repeat the safety test, but not more than 5 times. Should a drop of insulin still not appear, replace the needle and conduct the safety test once more. Change to a new pen if you do not see a drop of insulin after changing the needle. After the safety test, select your required dose by turning the dose selector. To correct the dose, you can turn the dose selector in either direction until the correct dose lines up with the pointer. You can only select the number of units remaining in the pen. The cartridge contains an additional small amount of insulin that cannot be delivered. If your dose is more than the number of units left in the Elaspen, you may either inject the remaining units in your pen and then use a new pen for the rest of your dose, or use a new pen to deliver the full dose. Select the injection site exactly as demonstrated by your healthcare provider and clean it with an alcohol swab. Let it dry before injecting. Avoid injecting into previous injection sites or areas with abnormal skin conditions. Once the injection site is ready, insert the needle into the skin. Hold the injection button with your thumb and press it fully. Once the 0 is displayed, it indicates that the complete selected dose has been injected. Make sure the finger does not block the dose window. Keep holding the button for 10 seconds after the full dose is injected. Then, slowly pull out the needle. Here are a few things to remember. Elaspen must be protected from dust, dirt, food, and liquid. If the injection button is hard to push, pushing the dose slowly will make it easier to inject. If the injection still doesn't go smoothly, your needle may be blocked. Put on a new needle and perform a safety test again. If it still fails to function, you may have foreign material inside the pen. Change to a new one and make sure you conduct a safety test. After you have completed the injection, carefully reattach the outer needle cap to reduce the risk of accidental injury, and then unscrew the needle completely. Put the pen cap back on. Remove the needle and store the Elaspen separately. Store the Elaspen without the needle attached at room temperature until the next injection. Safely dispose of used needles in a sealed sharps container, such as a red biohazard bin or a sturdy plastic or metal container. Be sure to follow local regulations for proper disposal. After the pen is fully used, dispose of it according to the instructions provided by your healthcare provider. It's important to understand that different types of insulin have varying effects and durations of action. For more detailed information, refer to the instructions that came with your insulin.